A research report released by the Consumer Council found a lack of transparency in the charges of private healthcare services. The Consumer Watchdog made several suggestions to the sector, including the use of package charges that could provide greater price certainty to consumers. Samantha Lee has the story.
Over the past 4 years, the Consumer Council received 191 complaints about private healthcare services provided by private hospitals and day procedure centers. The total disputed amount exceeded $7.2 million, with nearly half involving price or charge disputes. One of the complainants received a budget estimate of around $120,000 for reconstructing a cruciate ligament, but the final bill turned out to be nearly $200,000. The hospital advised the patient to seek clarification from the doctor, who determined the charges, while the doctor said the medical group was responsible for setting the fee. The Consumer Watchdog said many private medical centers fail to disclose their price list online. Even if they showed their prices, the fee information was sorted by service items, which may be difficult for consumers to understand. For instance, inpatient hemorrhoidectomy surgery can range from $33,000 to $85,000 in the same hospital, representing a 152% price difference. The council also noted just a few health centers offer medical packages that involve fixed fee covering certain services. But the prices of excluded items were frequently undisclosed, such as medication, consultation fees, and doctor's fees. The government is exploring legislation for price transparency. The Consumer Watchdog suggested the authorities develop guidelines for private hospitals and medical centers on presenting charges in a user-friendly format. Medical services providers should also update their charges in a timely manner and list them clearly. In the long run, they were also encouraged to introduce more packages tailored to various levels of medical conditions.
Despite, there are different channels for consumers to file their complaint, according to our survey, they have no idea where to. So we believe it's so important to increase, the visibility and also the awareness on how they can file a complaint, if they want to.
The Consumer Council also recommends placing promotional materials at the cashiers and waiting areas of private hospitals so as to improve price transparency for the consumers. Samantha Lee, TVB News.